Welcome to my Lecto. Today we are going to discuss second part of the clavicle. If you didn't watch the previous video, first watch that video so you can easily understand what's going on in this lecture. Actually, in this lecture, we will discuss the impression, or we will discuss what muscles and what ligaments are attached to the clavicle. Let's start. Actually, clavicle attached to the sternum and the acromion process of the scapula. Here you can see that this is the acromion. Clavicle and this is the clavicle. Right and left. Clavicle attached to the acromion and form a joint which is called acromioclavicular joint. And the clavicle attached to the sternum, this is the central sternum, attached to the sternum and form a joint which is called Sternoclavicular Joint. And here are ribs which attach to the sternum. Actually, we discussed the 6 sides: superior, opposite, inferior; medial, which is towards the center of the body; opposite, lateral, which is away from the body; posterior, back side of the body; and the anterior, front side of the body. Here you can see 2 structures of the clavicle. This is actually the superior side and this is actually the inferior side. How will we differentiate that it is superior, that it is inferior? Superior side is basically smooth and the inferior side has different impressions or projections. We divide clavicle into 2 parts, medial and lateral. Medial also called sternal because it is towards the sternum, and lateral also called acromial because it is towards the acromion of the scapula. Medial is actually basically 2/3, lateral is 1/3. In the lateral side, 2 muscles are attached to the clavicle. Trapezius muscle, which is actually the back, which is actually present at the back side of the body, and the deltoid muscles, which is actually present at the corners of the shoulder. And the medial side, 2 muscles are present: Sternocladomastoid muscle. This muscle is actually, sterno means sternum, clado means clavicle, and mastoid process of the temporal. Sternocladomastoid muscles is actually a muscle which attached to 3 different bones: sternum, clavicle, and mastoid process of the temporal bone. And another muscle which is called pectoralis. This is the pectoralis major muscle attached at the superior side of the clavicle. Actually, this is the inferior side. We will first discuss lateral side. Trapezius muscle at the top, opposite will be the trapezius muscle. Here is the deltoid muscle, opposite will be the deltoid. Because these muscles are present at the corners of the clavicle, some part will be present at superiorly and some part will be the inferiorly. So we see some parts will show on the superior side and some part will be present inferior side. Actually, what muscles are present at the lateral side? Another thing, that there are impression or ridges present in the lateral side. This is actually the conoid process, or you can say ridge, and here is the trapezoid process, and the ligaments attached to these sides. Conoid side will be the conoid ligament, trapezoid side will be the trapezoid ligaments. Both of them we collectively call Coracoclavicular ligament. So this is the lateral side. And medial side. Actually, this is the pectoralis muscle. Opposite will be the pectoralis major. Sternocladomastoid muscles has no impression in the inferior side, but other muscles are present at the inferior side. What muscles? Subclavius muscle. Actually, this is a muscle which is just below the clavicle, so we call it subclavius muscle. And another muscle which is called Sternohyoid muscle. Sternohyoid muscle is actually a muscle which attaches hyoid bone, clavicle, and it can also attach with the sternum. So this is the sternohyoid muscles. And here you can see, which is shown by the red color, is the Costoclavicular ligament. Costo means costal cartilage and clavicle means bone. Actually, here you can see that ribs are not directly attached to the sternum. They first attach to the costal cartilage and then attach to the sternum. The ligaments which is present between the costal cartilage and the clavicle is the costoclavicular ligament, because it attached to the costal. Here actually is the costal cartilage and here is the ribs. So the ligament which attached to the costal cartilage and the inferior side of the clavicle is called costoclavicular ligament. So this is the all about the muscles. Trick to remember, at the lateral or you can say acromial side, what muscles are present in it? Top dead center, TDC. T stand for trapezius muscle. D stand for deltoid muscle, and C stand for it's not a muscle, it's actually a ligament which is called Coracoclavicular ligament. Coracoclavicular ligament. At the medial side or you can say sternal side, what muscles are present in it? You can remember it by Prince Charles Secondary School System, PCSSS, triple S. P stand for pectoralis major. C stand for what muscles are? C stand for costoclavicular ligament. Pectoralis major is actually muscle. Costoclavicular is actually a ligament. S stand for subclavius muscle, and other S stand for sternohyoid muscle, and last one another S stand for Sternocladomastoid muscle. So these are the muscles attached to the medial side of the clavicle. So this is all about the clavicles and what muscles and what ligaments attached to the clavicles. If you have any question, then you may ask in the comment section.